One of my biggest goals is to be able to be a highly specialized surgeon who can kind of take care of any patient who walks into the hospital. And I wanted a program that wanted to foster that in me, and I felt that Mayo Clinic really does that very, very well, because you can come out of this program and do any subspecialty. You have access to all the best resources, research opportunities, mentorship. Also, what really appealed to me was the really strong emphasis on education.
As soon as I stepped on campus, one of the first things I noticed was just kind of the culture of the place, the way that the residents interacted, the staff interacted with the residents, and just the feeling of the entire campus and how it was all working together and kind of centered on the patient. I called my wife in the airport mid-interview season, and I told her that this was the place that I wanted to be.
Picking the right place to train is a very important task. Those that are interested, those that want to learn, those that come with exciting ideas, it's a perfect match. The training they get will be partially up to them, really, what they want out of it. What it's really about is what you've become, and that is someone that is focused on excellence, compassion, and proficiency, and that's what we hope for every one of our trainees.
Surgical training at Mayo Clinic started here more than 100 years ago, and it started, as the clinic did, as a surgical practice. As the practice has grown and expanded, the complexity, the volume of cases that are done here, the diversity of cases that are done here provides just a singular environment for surgical training.
When you come here as a learner, you're going to experience amazing things, amazing opportunities to become a surgeon, which is the ultimate goal. And in the OR, you're going to have world-renowned faculty educating you, one-to-one.
You're in the operating room day one, and you're going to get a lot of exposure. Just entering my chief year, I've already met my graduation requirements for all the categories of my cases. I'm going to have more than 1,500 by the time that I'm done.
The Department of Surgery at Mayo Clinic is comprised of 12 different specialties, 100 surgeons, and with over 120 operating rooms, teaching opportunities abound. About 20% of the cases that residents we involved with have multiple surgical specialties involved, owing to the complexity of the case, but also trying to transform our care of patients into newer, better, more effective ways.
I think one of the best parts about this program is the preceptorship model. And what that really means is you are kind of tied with a consultant. You are their personal resident. And that means for, 5 to 7 weeks, if they're in the operating room, you're in the operating room. If they're in clinic, you're also in clinic with them. And you get this really close kind of mentor education where you're learning how they do things. By the time, you're done with your rotation working with someone, that allows you the trust and opportunity to a lot of times progress in your training.
We have adjuncts to education, and that's when we use simulation. We have 2 simulation centers in both campuses, the most advanced simulators available, and it's available 24/7. On top of that, we have weekly didactics, and then we have M&Ms, journal clubs. Those are going to be specific to the rotations that you're going through. It's going to be a mix of fellows, residents, students, faculty. It's an extremely rich environment for learning. Everywhere you go as a learner here at the Mayo Clinic.
The things we're doing today are not the things I learned in my residency. Technology and innovation is changing so fast. It's amazing. Most of the patients I operate on now in my practice are patients we would have never offered surgery to when I was a trainee. Between surgical techniques, but just the care of the patient, the innovation and treatment options, we've been able to really change the landscape of who and how we take care of patients.
Mayo is exceedingly collaborative. There's nobody who is unwilling to talk about a patient, take an email, take a phone call, help, assist. That core value of the needs of the patient come first, which sounds like something we would just put on the letterhead. The people who work here really hold that very strongly, from our trainees to the advanced practitioners to the surgeons to the medical docs. It's kind of ingrained.
The goal of the care at Mayo Clinic is to constantly innovate, to deliver the best possible care for each patient. And so there's lots of different ways that research incorporates into what we do. We have innumerable clinical trials here at Mayo Clinic where we're trying new approaches and new treatments. And so that's an active area that the department's involved in. There's quality improvement projects, there's device trials, there's all kinds of basic or translational research labs and are really pushing the needle on innovative approaches for individual diseases. So there's several different ways for people to take time. The most traditional has been the clinician investigator program. We have a few residents doing master's degrees. We have one resident who is doing a PhD in a clinical and translational sciences track. So there's several different programs that we've got up and running at Mayo Clinic and opportunities for the residents to take a part in.
For those applicants that are thinking, I don't want to be an academic surgeon, I want to be a community surgeon, we have the track for you. The rural track is meant to train general surgery residents that they will go out to the community. We recognize that there's a need, not only here in the Midwest, but there's a need in the nation. Whatever you want for the future, we can tailor it. I would say the majority of our residents will go to specialized fellowships, advanced fellowships in their specialty, and I'm very proud to say that most of our residents have been able to get to the fellowship that they want.
One of the big things I was looking for in a program was access to global health opportunities. And thankfully at Mayo, we have the Mayo International Health Program, which allows folks to go abroad and to do a rotation in various specialties. Those opportunities exist from a clinical standpoint, from a research standpoint. What's so beautiful about Mayo is that we have a tradition of inviting doctors from around the country, around the world to train here, to share their knowledge for us to share with them, to create this really kind of global institution. I think we're really following in the footsteps of the Mayo brothers in creating that sort of global footprint.
So when we think about diversity and inclusion, the question I always get is, as a Latino woman surgeon at the Midwest Mayo Clinic, what is my experience? I have to say that I'm extremely blessed to work in a culture, in a hospital, so open, so diverse, so inclusive.
As surgeons, we have demanding careers, demanding jobs, and we can, some of us can naturally tend to focus on just delivering excellent patient care and keep pushing, and sometimes we'll minimize maybe when we're getting tired or maybe when we need some support. And so it's important for us to encourage and support the well-being of all of our residents. And the goal of that is really to remove the stigma of burnout or the challenges that we can have with well-being and maintaining our well-being.
I think living in the Midwest lends itself to, especially in training, to wellness. The community is accommodating, the cost of living is accommodating. I think the outdoor activities, sort of the camaraderie of the place, I think that lends itself to wellness, which, we're also very attentive to in our training programs.
One of my favorite parts about Rochester is just how convenient everything is. I can get everything that I need within 10 minutes. It takes me like 5 minutes to drive into work. Easy place to live. Everything that you would need is here. Good restaurants, recreational activities.
I think another thing that you get out of coming to the Mayo Clinic is this huge networking. You've been trained, you get to know faculty, again, well-renowned faculty, and you will always be part of our family. I tell the residents when they graduate that they have a stamp of the 3 Shields in their back, and everywhere they go, they are bringing a little bit of us.
One of the reasons why we're very selective on who comes to this program is we acknowledge they're the ones that are going to move this dial much further than we have. What we expect from them going forward is to transform the practice. We want them to think about how they've been trained by maybe 2 or 3 different surgeons that do the same procedure a little differently, and to be able to elevate that with new technology or new ideas and really move that forward. We call it standing on the shoulders of giants, and this is the group that will be those people.
This was my dream program. I wouldn't have changed anything. I'm very happy with the clinician and the surgeon that I'm walking away from this program. If you want to become an excellent general surgeon or a scientist, it has the operative experience, it has the opportunities for research, it has the flexibility to pursue your interests, to have that all combined in a culture of excellence. I think Mayo Clinic would have that for you.